Under the medication and orders, there is a search field to search any medication that you need or a test. For us today, we'll be ordering a few lab tests. The first one is CBC. When you order CBC, if you've ordered it before in the past, it will give you a drop-down menu that is the most frequently ordered CBC. But for this session, I will click New Orders to see the difference between Preference List and Facility List. As you can see, this physician has a set facility list. These are the most frequent lab works that he uses in CBC. And if you're ordering multiple lab work, I would recommend using Select and Stay. So I'll be using the CBC. Make sure that you actually show that there is a resulting agency that's attached to the order. The one that says POCT are done in clinic, such as a quick CBC, as they call it once upon a time when I was a nurse. I'm going to pick the first one, and I'm going to click Select and Stay. Doing this action produces a list or a basket for me to see what orders I have completed already. The next order I'm going to do is TSH. And I'm going to click the magnifying glass to show me my frequently ordered TSH. I just want the simple one, and it is attached to a resulting agency, actually several one, and I will click Select and Stay. And then another one I'm going to order is A1C. I'm going to click the magnifying glass again, and I'm going to pick the first one. Once I completed the number of tests I wanted to pick, I'm going to go ahead and click Accept if I'm happy with it. Let's just say I decided I wanted UA also. And while I was talking to the patient, she said, oh, I just got it done right before I came here. So I already have that done from the previous visit. And so I decided that she doesn't need another UA or urine analysis. All I have to do to remove this test is click the red X to remove it from my list. That's all you have to do. When you've completed the orders that you need, all you have to do is click Accept. It may take a moment. These patients have several medication, which is on the top of the list under medication and orders. So I have to scroll all the way down pretty much toward the bottom of the section to see what the orders I have. Remember when I said when I wanted to remove an order because I didn't want it? It also belongs here. If I didn't want the A1C, I can also click Remove and it will do the same thing. If you want to make sure to verify that the order is going to a resulting agency and it's the proper ordering summary that I need, I can click the summary hyperlink and it will open the specific order. One thing nice about it is that it will give you the last resulted CBCs for comparison. At this moment, I am teaching how to order a normal lab. A normal order or a normal lab means it is going to be drawn right now or today, whether it's in clinic when the resulting agency has a representative in your clinic, or down the hall and they're doing it right now. That is the most important one because majority of the time, physician will like that order that result immediately. Pretty much it's all routine. Very seldom that we order stat unless the patient is in distress. Therefore, we will send them to the ER anyway. This is the difference between lab collect or clinic collect. I will talk about clinic collect later in this session, but right now let's concentrate on lab collect. I know the order, since I ordered CBC, it automatically shows me that I want specimen source, which is blood. I want to make sure that my resulting agency is what I want. if you click on a magnifying glass, you can see the list of labs that we actually send labs to. But for right now, this is what I want, and that's all I need to do. And I will click accept. You will then go ahead and do the other two on your own if you wish, but I know I've checked it before. I know it's the correct one, so I won't even bother. Of course, every lab or every order has to be associated with a diagnosis. So you can click diagnoses, associate, and you can click to see if there's any diagnosis in this visit. If you already have picked your visit diagnosis, it will automatically show it here. It will auto-populate the window, but because I did not do that, I'm gonna have to add a diagnosis. Just to be easy for me, I'm gonna type DM for diabetes. And as you can see, there's a lot of them. I'm just gonna make it for everybody, and I'm just gonna pick the simplest one. This is called the diagnosis calculator, if some people doesn't know what it is. Again, I'm gonna make it easy for myself, and I'm gonna pick without complication. Once I see the green ICD-10 code, I am now allowed to click accept. You will not be able to go ahead unless this visit diagnosis is green. I'm going to go ahead and click accept. Because I ordered the 3 tests at the same time, all you have to do is click the diagnosis itself, and we'll highlight all 3. I will go ahead and click accept again. So now all the diagnosis diabetes is now associated to all 3 tests. How do I know that? Because this interlocking ring is beside each one of them. So I have finished ordering my labs. I'm going to click sign. It will perform a second verification, that making sure that I'm ordering the right one. It will tell you that I've successfully ordered it, and you are done. Now let's just say I want to order something called a clinic collect. An example was that UA that I was speaking about, or a pregnancy test, which is really a very good test that we use as clinic collect. I'm going to go ahead and order pregnancy. Hopefully it'll show up for me. I'm going to pick the one that says POCT because that's point of care. Since I'm not going to order any other tests, I'm just going to go ahead and click accept. I will scroll down the window and find it. I want to make sure that I associated with the diabetes. As you can see, what I said before, because I've already selected my visit diagnosis, it auto-populates this selection. And I'm going to go ahead and click sign. So here I am now a nurse, and the doctor just came out of the patient room and said, I need you to get a pregnancy test on my patient. So I, as a nurse, then go out and look at my patient list of the clinic. I will then go and highlight the patient's name, change you can either type visit orders here or just go to the magnifying glass and look for the visit orders. Another thing that you can see is that there's a blue circle here, meaning there is a task that I have to complete before the patient leaves for the day. It also shows the different orders that the doctor have ordered, not necessarily mine, but the doctor has ordered for the day. I will click POCT. I don't see it. This is just the order. Yeah. Oh, enter result. No, I wanted to, yeah. Enter result? Okay. So I'm going to go ahead and look for the order that the doctor wanted me to collect, which is the blood urine. All I have to do is click enter result. I will now have, if the resulting agency, so the pregnancy test value is negative or positive. It's negative. The successful QA is yes. Is it abnormal or not? It's normal or negative. And this is where you can pick whether or not it's a preliminary test, in progress, or final result. Once I completed that, there is no resulting lab because it's done in the clinic. And then I'm going to click accept. If I am doing another test, a POCT for another patient, I can go ahead and click next, and it will go to my next resulting lab. It wants a resulting provider because I forget it. And you can enter it right there. Or you can just continue on and forget all about it, but don't do that. That was my mistake. As you can see, it is now our final result. It's routine, and it's now resulted. Another thing I can do is, let's just say this order, the patient is still there, and then the doctor reminds, oh, you just did a CBC a few days ago. You really don't need the CBC, so you need to cancel the order. You can do two things. You have to do two things. If the patient is leaving with a paper order, you have to strike through the order that you do not want, initial and date it, because that's what the lab people wants. It's a proof that you, the doctor, actually did it, or the nurse. And then you have to go to the system and cancel that order. I can go ahead and click the patient open again. You know, it doesn't have the, start visits. I'm looking for, where's your order review? Here? I couldn't cancel it in order review. I mean in chart review. I had to go to order review to do it. This looks different. There it is. So as I said, if I wanted to cancel a lab before the patient that you have already printed, but before the patient has gone to the lab, you have to cancel it both from the paper by striking it through initial and date, and also in the system. Because if you don't, and it wasn't drawn, it's going to go to your in-basket as a overdue result. If you do not cancel the order in the system, it will go to your in-basket as an overdue result. If you want to discontinue an order, but the patient already left for the lab, you can go ahead and go back to your meds and orders, and again scroll down to the bottom, and you will see the 4 tests that you just ordered. I wanted to remove TSH, and all I have to do is click the X. It will ask you why you're canceling it. So here's a different one. It's a duplicate order for me. Click accept and then accept. That will then be, it will not be deleted, but it will be strike through saying that you have discontinued that lab. In this section, I'll be ordering a future order. A future order can be one future order or several, which is called a standing order. But I want it, as a physician, I want it done in the future. So I don't have to remember that in 3 months I have to order an A1C for my patient because he hasn't exercised and it's going up. So my patient is here today. I've drawn his fasting glucose and it's quite high. So I wanted to make sure that his A1C is not going up to indication for diabetic medication. So I'm going to order an A1C. As you can see, I made an error and picked AIC, and the system does not recognize it. So I'm going to try it again. There's my A1C. Because I repeatedly order it, it comes down quickly. So I'm just going to pick that one, and I'm going to click accept, just like before. I will scroll in the bottom of the page, and there would be my A1C. To make sure that it is going to be done in the future, I need to open the summary hyperlink, and I have to change the status to future. Once you change the status to future, it will ask you for an expected date. You can either write the time, but since I can never remember what is 3 months from now, I will go likely and be happy to click 3 months from now. If you want, you can either pick a specific date or an approximate date. So just in case Michael forgets to actually come by October 14th. The expiration date of this order is 1 year. It is routine. It doesn't have to be stat. It is lab collect. It is drawn by blood. And he's going to do it at LabCorp. We're going to go ahead and click associate to make sure that we associate it with a diagnosis. And I'm going to go ahead and sign it. The difference between now orders and future orders, with now orders and the patient is present at this time during the visit, you pick now. You want it done now. Future is anything except any time in the future, including tomorrow. The one thing that's important about that is you have to make sure you put the expected date. The lab work will be auto-released 7 days before the expected date, so the patient can come within the 7 days before the expected date. If the patient doesn't arrive by the expected date, the test will go into the result pool as an overdue lab. The nurses and the physician may then call the patient to remind them that they have an order that needs to be done. Standing order. Standing order is a process that utilized for labs to monitor an interval timing. So a series of labs to be done in a specific interval. And an example would be PT and INR, which is done for Coumadin therapy. Or A1C, it could be done every 3 months to monitor a patient that's pre-diabetic. The 3 components that's required is changing the status to standing, setting the interval, which is the frequency of when the test is to be done, and the count, how many times you want that lab to be drawn in the future. So I'm going to show that to you now. So I'm going to order PT and INR. I can see that I'm going to pick the first one. I'm going to go ahead and scroll to the bottom. I'm going to go ahead and associate AFib. This patient has 2 diagnoses, as you can see. You can go ahead and pick both to be associated with, or you can just pick one, which is that really is what is it for. There's also a diagnosis, as you well know. I don't have the anticoagulation therapy, but it's too long, so AFib is much quicker to choose. I'm going to click accept because this is a standing order for Coumadin control. I'm going to open the summary, put it as standing. Release is auto-released. Interval is what? Twice a week? Count, let's just say 5 or 4, I should say. It's going to, the reason I only ordered 4 is maybe you wanted the patient to, after 4 visits, which is about 2 weeks, you want the patient to come back to recalibrate his medication, would be an example. It is lab collect. I changed it to standing. I changed the interval and the count. The expiration date is 1 year. The rest looks good, and I'm going to go ahead and click accept. I already associated it just to make sure I'm looking at it again, and I'm clicking accept, and I'm signing it. When the orders are signed, a paper requisition form with a barcode will automatically print. As a reminder, if you're going to reprint a requisition, the barcode will not be there. So your staff will have to rewrite the barcode, and if you have to reprint the order requisition, I just want to remind you that the requisition number and the control count will not be in the duplicate requisition. Please write it down on the requisition page. That's it.